Good morning, Dr. Virdi is my name. I did my MBBS from Patiala Medical College in the year 1976 and then went on to do my MS in General Surgery again from the same institution in 1981. Immediately thereafter, I came to the Postgraduate Institute of Medical Sciences in Chandigarh, which is a premier institution for medical education and research, and did my MCH in cardiac surgery and passed in the first attempt in 1983. Thereafter, I went to the United Kingdom in 1984 and did my FRCS in general surgery first, and then FRCS in cardiothoracic surgery from the Intercollegiate Board. I came back in 1986, but there wasn't much opening in the areas that I had acquired expertise in my own country, and so went to Australia in St. Vincent's Hospital in Sydney in 1986, and for the next 10 years practiced in that country and did my FRACS, that is Fellowship of the Royal Australasian College of Surgeons in Australia. In 1995, the Apollo Hospital, Delhi, came along, and I got an opportunity to head a unit in that hospital, and I took that opportunity, leaving my thriving practice in Australia, and I came back to India. For the next 6 years rather, up until 2001, I practiced cardiac surgery and did about 3,000 heart operations in Apollo Hospital, adding on to my experience of about 2,000 heart operations, heart and complex lung operations in Australasia. In 2001, I went back to Australia as associate professor and director of cardiac surgery in North Queensland, and because my young family was growing up in Australia, and then worked in that capacity for another 6 years in Australia. In 2008, I came back to India as the Pan-Max Chief of Cardiothoracic Surgery and started my practice in Max Hospital, Saket. I worked there for another 6 years, and during these 6 years, I did another 3,000 heart operations. And in that intervening period, where I was the associate professor in James Cook University and senior consultant cardiac surgeon in Townsville Hospital, I performed about 1,500 heart operations. So till date, I've done close to 10,000 heart and complex lung operations. I moved to the Tri-City in January 2013 and have now spent 2 years in the Tri-City as the managing director and chairman of the Institute of Cardiopulmonary Sciences. I run 2 hospitals, one in Panchkula and one in Gurgaon, and I head the cardiac pulmonary sciences program. We do about 30 to 35 heart operations in Panchkula and about 25 to 30 heart operations in Gurgaon, adult heart operations. And recently we have started neonatal and infant cardiac surgery, where one of my proteges from Max Hospital, Dr. Asim Shervastav, has joined as Director of Pediatric Surgery, and he's doing an exceptionally good job. Our Department of Cardiology is a very aggressive department. They do about between 60 to 80 angioplasties in Panchkula and about 30 to 35 angioplasties in Gurgaon. So all in all, we have a active, very active cardiac program, and the thoracic program and the pulmonology program is just taking off after I've joined. So we try and practice medical science according to the highest ethics that one has acquired over 20 years of practice overseas. No patient is fleeced. We make a fair profit, but profiteering is not indulged in and is not tolerated in my institution. There is an ethos of holistic practice, and we adhere to that in the entire super specialty hospitals in both cities. We have an active neurosurgical program, active joint replacement and orthopedics program. We have an active plastic surgery program, bariatric surgery and advanced laparoscopic surgery is also being performed, and we have a high-end Institute of Renal Sciences where we perform about 1,000 dialysis in both hospitals. We would soon be embarking on a renal transplant program, and because of my extensive involvement with heart and lung transplantation, we hope to start a low-profile, meaningful heart transplantation program towards the end of this year. My main field of interest is coronary artery surgery, valve replacement surgery, aortic surgery, surgery for heart failure, and surgery for complex lung malignancies. Punjab and Haryana, might I add, being the cancer capitals of the country, we have a lot of cancer burden, and slowly it is being recognized that we offer high-end surgical treatment for lung, chest wall cancers, and we hope to develop that specialty too in the near future. So thank you very much for your time and attention.